Hey everyone, so for this video I thought I'd go into more detail and show you what exactly I'm doing when I treat my patients. For this video I'm obviously going to be treating my wife, and she's kindly agreed to volunteer for me. So in my practice I really prioritize improving neuromuscular movement and mechanics using different types of myofascial release techniques. Most chiropractors just crack your neck and back and call it a day, which I know many people enjoy, and I want to stress that there's nothing inherently wrong with doing that sort of treatment. Just know that it's a very poor long-term solution. Many people do get some relief, but if you come to my office to see me for some sort of complaint, I want to actually help solve the issue for you and not just make you feel a little better temporarily, although that's also a bonus. Properly treating musculoskeletal issues requires doing some sort of manual therapy, some sort of rehab, and some sort of lifestyle modification if possible. You'll hear me allude to these three things many times in these videos. You can see here that I'm working on my wife's hips and lower back. From a mechanical perspective, when it comes to treating the lower back, I do focus most of the treatment on the hips. Basically, if your hips are dysfunctional in any way, meaning they're tight, they're weak, whatever, your back will work harder to compensate. It's not that your spine is super fragile and can't handle anything or the extra load, but for most individuals who do not routinely exercise and are fairly sedentary, this extra load will lead to increased muscle tightness, which inevitably leads to joint pain and disc injuries. Now, if you went to a regular or traditional chiropractor, the treatment would likely involve an adjustment to the lower back, and if you're lucky, this would be preceded with a 10-minute hot pack session to help loosen things up a bit. The key issue here is that the adjustment is just working to introduce additional movement to the joints in question. It's not fixing anything, it's not aligning anything. As I said, for many people, it does produce some temporary relief, but over the years since I've opened my practice, I find that many people opt to simply pop into the chiropractor, pun intended, for a quick monthly or even weekly adjustment and tell themselves that they are being proactive. The reality is that in the weeks, months, and years that are going by, their back is actually likely getting worse because they aren't doing anything to actually release overly stiff muscles, and they aren't doing anything to strengthen muscles that need it. This is why I have the opinion I do on traditional adjustments as a form of treatment. They do help, and there certainly is a time and a place for them, but people need more. In my opinion as a chiropractor, my job is to help you understand what's going on and work with you on a long-term solution that involves precise soft tissue work, manipulation as necessary, and appropriate rehabilitation and strengthening exercises. This is the real solution that most people actually need but rarely actually get. I know this opinion might bother some people, particularly those chiropractors who are subluxation based or more traditional overall. But I completely stand by what I say here and what the current literature tells us with regards to treating chronic musculoskeletal pain.